The first time I looked at the blood vessel plaque as a student, I thought, oh my gosh. But it makes sense because here's the heart. Its job is to pump blood that's oxygenated to the body. That's the red vessels. The blue vessels is blood returning to the heart to pick up oxygen. Okay, then we just have to kind of figure out, okay, the heart wants to get blood into the head. And so the first branch, major branch coming off this aorta, I know it may be hard to see, but right behind here is the brachiocephalic. Right there you see it, brachiocephalic, and there's the word. I like that because brachii means arm, cephalic means head. And indeed, it goes into the arm and into the head. Second branch is going to be the common carotid. So coming right here by the jugular is blue, the common carotid red, feeding the brain. And then let's get some blood moving into the shoulder and arm. And that's what the subclavian is for. Sub means under the clavicle. And here indeed, you can kind of imagine this is the patient's left clavicle area. And as this subclavian passes down to the armpit, it gets a new name because there's a branch, just like a street. When a street forks, sometimes it gets a new name. Axillary. It's going to branch some more. Brachial, which means arm. And then finally down into the palmar region and the digits. I want to take a close look at the arm because when we do blood draws or set up IVs, but here's a nice view. Aorta, that must be the brachiocephalic first branch, and that is the common carotid coming there. And then barely on the patient's left side, you can kind of imagine the subclavian coming across there. You can see the subclavian here too coming. But let's pay attention right here. When I do a blood draw, my choice is always the cubital. It comes right across. It's under low pressure. Second choice, especially on obese patients, the cephalic. It's coming on the lateral aspect of the arm. And I usually catch it right about there. I make sure and position my needle. I palpate. I use my fingers and I figure out which way that vein is going. Because if you insert the needle here and go straight, you're going to hit an artery. And that's why I don't like the basilic. Look at the basilic. Okay, it's a lovely vein. And it's large and easy to see usually. But if you hit the brachial artery by mistake, you can imagine, okay, here's the basilic, there's the brachial. Brachial is under high pressure. Blood starts spurting out, then we have an emergency. So, top choice, cubital. Second, cephalic. And I've drawn the basilic, but I usually like to draw it up high, just to be safe. Okay, this looks like a complicated situation, but it's really not. Technical word for liver is hepatic. So we have hepatic portal vein, bringing blood away from the liver. Hepatic portal or hepatic artery going into the liver. Technical word for kidney is renal. So we have a renal artery, renal vein. This is the abdominal aorta, and this must be the inferior vena cava, IVC. Okay, so that's bringing blood back up to the heart from the appendages. There's a celiac trunk here, which is where the gastric for the stomach and the splenic artery branch off. And I'll tell you, it's hard to figure out even in real life. Splenic's easy because there's a spleen, splenic artery, splenic vein. And you can see the mesenteric, which we need to get blood to the colon and the lower bowel. So we have the superior mesenteric, which means it's above, and the inferior mesenteric, which is lower. Now, if you're wondering where we are, we're right near the groin, and this big abdominal aorta is going to fork into the common iliac. It means common. It doesn't mean like it's average. It means that it's going to branch. The word common means branching is coming, and here it is. Internal iliac, external iliac, and this is going to continue into the legs. So here I am, okay, there was the internal, now it's the external, and you can imagine there's the femur, large bone of the leg, and so it makes sense. This is the femoral artery, and this is why when someone breaks their leg, it's really quite dangerous. You have to immobilize that leg, or the jagged edge of that bone is going to sever the femoral artery, and this is what causes death. When people break their leg, it really is a frightening situation. You have to keep that femur where it is. Use whatever you got, newspapers, magazines, sticks, but don't let that leg flop around. Popliteal, which is here, it kind of means knee. Then we have the fibular, or peroneal, which goes behind here on the calf. And we have the anterior, which means on the front. And down into the dorsalis pedis, or dorsal artery of the foot on the top. You can take a pulse right here in emergency medicine, just to make sure that blood's getting to the extremities. The saphenous, which there's a small and there's a great saphenous, which I like, because this blood vessel can be removed because other blood vessels pick up the job, and that fragment of blood vessels can be stitched in somewhere else, and usually in a case of emergency. There you have it. It's not so confusing, huh?